Hi, I'm Jim Torgerson, CEO of the United Illuminating Company and Chairman of the Connecticut Regional Institute for the 21st Century, more commonly referred to as the Institute. The Institute provides continuing opportunities for its members and other organizations to discuss and study important issues regarding Connecticut's competitiveness. For the past 2 years, the Institute has tracked the state's continuing battle to wrestle with the growing fiscal and economic crisis. The economic downturn has created both increased need for public services while sharply reducing state revenues. The numbers in Connecticut are of increasing concern and can seriously impact all levels of government in the state. We recently engaged the accounting, tax, and business consulting firm of Bloom Shapiro to help us review major budgetary program areas in Connecticut and to quantify savings and identify opportunities that can be realized within the next fiscal cycle and over years to come. This report, entitled Long-Term Care Project Findings, is the first in a series of such efforts that the Institute will undertake between now and the fall of 2010. Our goal today is to provide political leaders in the executive and legislative branches of government with tools to reinvent Connecticut's approach to state government and the delivery of services. I'm joined today by Brian Renstrom, a partner at Bloom Shapiro, who will provide us with an overview of findings pertaining to long-term care.
Thank you, Jim. Let me start by saying long-term care will affect all of us at some point in our lives, either because we need services and support for ourselves or because we are providing care for someone in need. Regardless of age, health, or wealth, it is unlikely that any of us will be able to escape the issue of long-term care. Finding ways to avoid an ever-increasing spiral of long-term care costs funded by the state is in everyone's best interest. It's also important to note that based on a study by the UConn Health Center, 80% of Connecticut residents would prefer to receive long-term care in their home. Connecticut's long-term care Medicaid payment system, which accounted for 14% of the state's total 2009 expenditure, will cost as much as $5.847 billion by year 2025. This escalating cost can only be controlled by the state adopting and implementing a strategy based on a guiding principle of the right care at the right time in the right place. A major component of this philosophy of the right care is the rebalancing of care between institutions and home and community-based services. By rebalancing its long-term care system and achieving its goal of 75% of care being home and community-based over the next 15 years, Connecticut can reduce its projected $5.847 billion in long-term care costs by $900 million per year by the year 2025. Without this rebalancing, and assuming no progress is made in rebalancing, the future need for nursing facility care would rise by 43% during this same period. The key to the rebalancing initiative is to recognize the importance of both institutional care and home and community-based services in the long-term care continuum, and to continue a system that appropriately provides the right care at the right time. If we don't take action now and address this issue, the economic future for Connecticut looks even bleaker than it is now. Consider this. Connecticut's long-term care Medicaid payment system, which accounted for 14% of the state's total 2009 expenditures, will cost as much as $5.847 billion by 2025, when the number of residents aged 65 and older is expected to increase by 40%. At the same time, we can expect a 5% decline in the number of Connecticut adults between ages 18 and 64. What makes these figures even more troublesome is that the 18 to 64-year-old age group comprise the population of informal caregivers that truly is the backbone of the state's long-term care system. These family members and friends currently assist the greatest percentage of those receiving long-term care in Connecticut. Last year, home and community-based services and institutions cared for 45% of the long-term care population, while this informal caregiver network accounted for 55% of care. In 2009, Connecticut spent $2.498 billion on Medicaid long-term care. This does not include private financing and informal care or other services for adults with psychiatric disabilities funded by the Department of Mental Retardation. Despite being offset by 50% in federal reimbursement, the net cost of covering Medicaid long-term care patients in Connecticut was $1.249 billion. And finally, it's important to note that Connecticut is behind other states in its rebalancing efforts. We rank 34th in the nation in terms of home and community-based service expenditures. Other states have successfully addressed the issue of long-term care costs while providing better levels of service to their residents. Connecticut has a fractured governance structure for providing long-term care that requires high levels of coordination among as many as 15 major state agencies. We hope you will give serious thought to our findings, as well as our proposed solutions to the problems currently facing our long-term care system in Connecticut.
As Brian pointed out earlier, regardless of age, health, or wealth, it is unlikely that any of us will be able to escape the issue of long-term care. Finding ways to avoid an ever-increasing spiral of long-term care costs funded by the state is in everyone's best interest. The Institute's goal is to provide political leaders in the executive and legislative branches of government with tools to reinvent Connecticut's approach to state government and its delivery of services. Over the next few months, the Institute will look at 2 or 3 other areas of state government impacting the state's current and future economic status. I invite you to be a partner with the Institute as we choose other areas of state government that could benefit from this type of objective review. Thank you for providing us with the opportunity to present you with these findings. For further information, visit our website at ctregionalinstitute.org.